but I'm not going to start until you hear me start speaking. You're all going to be great. Thank you so much for joining and so much for speaking. We're really grateful to have you. I'll share your expertise and how you're still serving your communities during these uncertain times. I know our audience is going to learn a lot from you, so thank you again, and I'm really excited to take us live. Please chat me in the chat box if you need anything. I will be here the whole time. And
one thing real quick,
Yep.
Sorry, because before we go live, if everybody can mute when you're not speaking.
Mm-hmm.
Sorry, you might have said that already, but I've just been on so many
No
Zoom
problem.
calls where they don't do that.
That's okay. All right, everyone, we'll take the conversation to chat, and I'm going to share my screen and press broadcast. So let's all go on mute. Hello, everyone, and welcome to our 5th and final session of this virtual Rural Child Hunger Summit. I'm so excited to bring you some amazing content and great speakers for our last session, Embracing Community Perspectives and Cultures in Program Design and Delivery. Before we get started, I'm going to go through a couple of housekeeping announcements. All attendees are in listen-only mode, which means that you can't ask your question aloud or share your video, but we will take your questions in the question box of the Zoom webinar feature. So if you can spot the Q&A box on the webinar, that is where we'd love to get your questions, and we'll have time at the end to do a Q&A with the audience. If you'd like to join the conversation on social media by sharing what you're seeing, hearing, and thinking, use the hashtag Rural Hunger, and you can tag us at NoKidHungry. And lastly, all recordings for today's webinar series and slide decks will be sent out to anyone who registered for any webinar today, and we'll also post them on our website at bestpractices.nokidhungry.org. And one last thing before we get started, I just want to call to your attention some of what No Kid Hungry has been working on in the world of coronavirus and school closures and child nutrition. As we know, it's top of everyone's minds. We've got 3 resources on our website that are constantly updated and refreshed with USDA guidance that comes out with new waivers for the child nutrition programs that are eligible to be operating during school closures. So you can check out our FAQs, our resource on emerging strategies and tactics that we're seeing and hearing around the country of school nutrition departments and nonprofit providers, how they're serving meals during this time, what precautions they're taking for their staff, some really great ideas in that resource. And we've got a new summary of all of the child nutrition waivers that the USDA has issued in response to the school closures. So you can find all of that at bestpractices.nokidhungry.org/coronavirus, and I'll send that link in the chat box, as well as the link for our grant inquiry form. We at this time are offering funding to support non-congregate and home delivered meals and emergency meal programs. We have a pool of funding available, so if you need some extra support to keep your programs going, I recommend that you fill out that grant inquiry form, and I will send that in the chat box shortly after I introduce Tracy Fox, who is the moderator for today's session. She's the head of food and nutrition policy consultants. Excuse me, not moderator, the organizer. Tracy has been working with us since the beginning of last year's summit in Louisville, Kentucky, and we're really grateful to be working with her again, and really grateful that she put together this wonderful session for us today. So I'm going to hand it over to her to introduce our moderator for this session and let her speak. Thanks,
Great,
Tracy.
thank you, Emily. I really appreciate it, and thanks to No Kid Hungry for your leadership in this important overarching area of rural child hunger, especially in these trying times. This session is going to explore different approaches to community engagement that highlight the importance of working with communities in co-creating and building capacity to address pressing needs. Panelists are going to share examples of their successful strategies for building competency and establishing trust in diverse communities. And I was certainly able, as I hope many of you were, to participate in a number of the sessions today, and there's a lot of overlap and a lot of complementary approaches that are discussed in each one. And this one in particular follows along nicely with some of the important themes that were highlighted in the racial equity and community resilience in food systems policy and program delivery one that was held earlier today. So this is a great extension of that. I am going to introduce Nonie Woolf, who is going to moderate the session. Nonie is an enrolled member of the Yakima tribe from Washington State and a registered dietitian. She worked for 30 years in the Indian Health Service as a public health nutritionist involved in providing nutrition education to community patients, family, tribal, and state feeding programs and clients. And in fact, a number of her nutrition education works have been used as a model for a lot of the federal efforts that the Indian Health Service is involved in. Nonie is executive director of the FAST Blackfeet organization, where she continues to provide leadership in food access, nutrition education, and healthy eating efforts. So with that, I will turn it over to Nonie to take it from here.
Good afternoon, attendees of the Rural Child Hunger Summit, and thank you for your interest in our presentation. Emily, can I have the slide, please? I'm actually the board chair for FAST Blackfeet, and FAST Blackfeet stands for Food Access and Sustainability Team. Our nonprofit has actually existed since 2015, and it became incorporated in June of we existed since 2015, and we became incorporated June of 2018. I live in the High Plains area on the Blackfeet Nation, which is in Montana. It's approximately 52 square miles of land that borders the Rocky Mountain Range and Glacier National Park on the west, and Alberta, Canada to the north. You see the big picture in the slide. It's an older picture of Browning, which is the town I live in. And the open area in the bottom of that larger picture is now filled with many houses. In the center of the large picture, you see a road that kind of leads up towards the upper right corner, and it goes 12 miles to East Glacier, which is on the edge of the reservation right next to Glacier National Park. There are 6 other smaller communities on our reservation. Seville, which is all the way to the other side by Cut Bank on the east of our border. Blackfoot, 6 miles out. Heart Butte, 30 miles to the south, which is actually in a separate county, Pend Oreille County. Star School, which is 6 miles out of Browning between here and Bab, which is 45 miles north, about 6 miles from the Canadian border. So we are spread far and wide. We are very small, and we have large unemployment rate in our community. We have beautiful mountains to the west, and the tribe has an INI program, which is growing our buffalo herd. INI means buffalo in Blackfeet. And then over to the east, we've got livestock, grain, and forage production. We have oil and gas on the reservation that a few people have going, fishing, and forest industries. These are major parts of our Blackfeet Nation economy. But our primary industry is agriculture, supporting grains that are harvested for wheat, barley, oats, and forage production. And then a lot of our area is used for grazing land for the ranchers. Given that, sounds like there's a lot going on, but there still is a lot of unemployment and poverty on our reservation as well. Slide 4, or next slide, I guess it is, shows beef production. Cows, horses, and sheep are pastured and penned a lot on the reservation, and that's a beautiful spring picture. We've got wonderful weather here when we have spring 3 months out of the year. Farms and ranches are owned and operated by like 906 agricultural operators, 54% of whom are Amscani Picani, which is a Blackfeet. Our people are still very close to their traditional native culture. The youth in the left lower picture are drumming at a New Year's powwow. We have immersion classes in our public system and private schools, which are where the students speak only Blackfeet. 2/3 of our population is estimated to be food insecure or hungry, and 80% of our school-age children qualify for free and reduced school lunches. Our spring and summer landscape is very beautiful, but 9 months of the year, our yards look more like the last two pictures you see to the right. We have Chinook winds here that cause the snow to drift across the highways. And in 2018, we had some days where all the roads to Browning were closed and the Bab Road had to be plowed open just to get through every single day. Our fast Blackfeet is housed in the Medicine Bear shelter, which you see where the forklift is delivering food there. And that's our first phase of development. We actually are planning to do a food resource center sometime in the future, but our food pantry is the big thing going right now. It's been open since September 2019, and we get our food from TFAP, local donations, purchases from the Montana Food Bank Network out of Missoula, Montana, and we've also purchased from the Hutterite colonies that are close by. OEOP Food Pantry, which means we are eating, provides food for emergency needs in our community. And we serve many more clients in the latter half of each month when SNAP, WIC, commodities are running low. In the past 5 months, we've served food boxes to a total of 1,116 families, and the boxes have had a total of 4,221 people. Of those, 1,973 are children under 17. So we estimated that 40% of the food we give out goes to people who are under 17 years of age. We've been well received in our community and are continuing to grow our network around the state and within our community among our local members. And now we're going to move to hearing from folks over to the east of the country, I believe. Taylor Miller has served at the Food Bank of Southeastern Virginia and the Eastern Shore since 2013. In January of 2020, Taylor accepted a new role as the Director of Western Tidewater Community Produce Hub. She holds a Master of Public Administration degree from Old Dominion University and a Bachelor of Science degree from Slippery Rock University of Pennsylvania. Taylor resides in Norfolk, Virginia with her spouse, who is actively serving in the United States Navy. And now I'd like to turn it over to Taylor Miller.
Thank you. Good afternoon, everyone. As Nonie mentioned, my name is Taylor Miller, and I am the Director of the Western Tidewater Community Produce Hub at the Food Bank of Southeastern Virginia and the Eastern Shore, which I will refer to simply as the Food Bank for the remainder of my remarks. The Food Bank is one of 7 food banks in the state of Virginia and a member of the Feeding America Network. Our food bank is uniquely positioned because we serve 11 cities and counties that vary greatly in terms of urban, suburban, and rural landscapes. Last year, we served over 14 million meals out of our food bank alone. The map that is displayed on the screen highlights our service area with a multitude of different colors that represent the percentage of food insecurity by census tract. Red being the areas of most concern, where the food insecurity rate is greater than 20%. To give you an idea of our geography, our southern border runs directly along the state of North Carolina, and we serve the entire Eastern Shore up to the Maryland border. Our main office is located in Norfolk, Virginia, which is much more of our urban area. You can see in the map here, the areas where there's just a bunch of little dots as the census tracts get much smaller, and that is our urban footprint. This urban area that is referred to as Hampton Roads throughout the region, it has a very large military presence and the largest fleet concentration area in the world. However, the 2 areas I will focus on today are the Eastern Shore and Western Tidewater, which are our rural service areas. The Eastern Shore is the part here that is disconnected from the rest of the state. For those of you who have made this trek before, you will be aware that the area is actually connected by the Chesapeake Bay Bridge Tunnel, which is over 17 miles long and costs over $15 for a normal passenger to cross. We actually have a branch of our food bank on the Eastern Shore. This area has a lot of agriculture, migrant workers, and it's home to chicken processing plants such as Tyson and Purdue. There is a large Spanish-speaking population, and we are recently seeing an increase in the amount of Haitian immigrants coming to the area. Our other rural service area is Western Tidewater, which is the area to the far west if you're looking at the map. While agricultural as well, the main industry centers around peanuts, cotton, and a paper mill in this area. As with many other rural communities, there are a few grocery retailers and limited public transportation options. While this region has been a part of our service area since the food bank's inception in 1981, and we have operated mobile pantries, partner agencies, the backpack program, kids cafes, and healthy school markets here, we have recently placed a significant emphasis on building capacity and scaling our programs in this region. It is our goal to open a brick and mortar community produce hub in this region with an overall goal of completely closing the meal gap, which would mean distributing over 900,000 meals per year in this region alone. This effort will be done in conjunction with other collaborative partners who focus on those root causes of food insecurity, so that we can not only see the line, but hopefully end the line as well. I'd also be remiss if I didn't mention that while all of this is still within our strategic plan, we, like many of you, are amidst our COVID-19 response to ensure that our region's seniors, children, and low-income families are able to get the support that they need during this uncertain time. We have set up strategic partnerships with our local school districts, YMCA sites, and senior services, just to name a few. While things are ever changing, in Virginia, all of our schools are closed at least through the end of the school year. And just yesterday afternoon, we had an announcement of a stay-at-home order. But with that being said, and during these evolving times, I would be happy to direct any of my remarks specifically to our crisis response as well. Thank you.
Thank you, Taylor. You make my numbers seem super small, I have to say. Okay. Okay, our next presenter is going to be Dr. Susan Sluka. And a little bit about Dr. Susan Sluka. She's the Associate Director at Montana State University Extension. Yay, she's in Montana. As a registered dietitian, Suzanne has served in a variety of PI roles with SNAP-Ed, Team Nutrition, and on grants from USDA, CDC, and DHHS to work on reducing hunger and obesity in rural and tribal communities in the Midwest. So I'm going to turn it over to Dr. Sluka. And can you tell me what PI stands for? I'm sorry, I'm terrible at acronyms. Here she goes.
Good afternoon, and thanks, Nonie. That's Principal Investigator, so thanks for asking. So I come to you from Montana, but primarily my work was done mostly in South Dakota. So I was at South Dakota State University Extension, again, moving from one land-grant university to another. So if you've not worked with the Extension Service in your state, each state has a land-grant university and has that outreach mechanism. So I highly encourage you to reach out to your contacts there. So in South Dakota in 2015, we started what we called the Growing Healthy Families and Communities Initiative. And you can see that from our logo above. And I think the logo really depicts the work, the broad work. So we have frontier, very, very rural communities. And we have a few urban communities, at least urban for our state. And then we have tribal communities. And so you can see that also on the map as well. And so we really wanted to work with a variety of these communities around health and wellness initiatives. And so some of the things that I'm just going to outline in that work is that what we tried really hard to do was listen to the communities and use community-based needs assessments and outcomes. And so in working, we set up about 15 different wellness coalitions, and we used just a variety of funding to make this work happen and to get participant input. And so whether that was SNAP-Ed dollars or federally recognized tribal extension program dollars or USDA beginning farmer rancher dollars, to really look at health and how we could help move these very rural communities forward. And so just a few efforts that we focused on, primarily that my work was really looking at rural food councils and how do you go about developing food councils in these extremely high poverty, high free and reduced lunch communities that didn't already have a lot of social capital or a lot of needs. And so we worked on that for about 4 or 5 years there. And then through our food councils, what we wanted to demonstrate and help them to do was to show the community that they had a voice in things that were going on. So whether that was strengthening the food pantry through some research that we did around what we called My Choice, it's based on the My Plate for USDA. So helping to shift all their food pantries to guided client choice models and measuring that impact and really coaching them and facilitating them through that process. And then finally, again, just looking at, well, if they have these councils developed, these wellness coalitions developed, how does that help their community to springboard and work on other health issues or sometimes crisis situations that come up? So I can assure you that these coalitions that are active and still functioning are working on COVID-19 right now. And that's because they've been in place, they've been active, they know what resources that they can provide. But they've done anything from saving and bringing grocery stores to these rural communities, to looking at physical activity opportunities, creating some of the very first handicapped accessible parks and playgrounds in their very small communities, to, you know, identifying gardening and local food production. So I will just stop there and hopefully can answer some more questions later. But again, my work is really primarily in frontier, rural, and tribal communities.
Okay, thank you. Thank you, Dr. Sluka. Our next speaker will be Bill Kearney. And I just want to say, a lot of the rural out this way, Montana is also frontier. Oh, okay. Dr. Kearney, not Dr. Kearney. Sorry, I've got too many papers here. Okay, let me introduce Bill. Reverend William Kearney serves as an associate minister at Holy Springs Missionary Baptist Church located in Warren County, North Carolina, where he lives. Reverend Kearney owns Bill Kearney and Company Consulting, LLC, is a partner in several University of North Carolina at Chapel Hill Community Engaged Research Partnerships, focused on physical activity and healthy food access in rural communities. Reverend Kearney advises and consults with universities, organizations, and partnerships across the state and nation. Reverend Kearney serves as Vice President of the United Shiloh Missionary Baptist Association Church Union and is employed as a research associate and community outreach manager at the University of North Carolina at Chapel Hill Center for Health Promotion and Disease Prevention. Reverend Kearney has co-authored numerous research manuscripts and articles and has co-produced various video and audio documentaries. He is also a managing partner of the Prime Collective Consultants, LLC, and Three Springs Holdings, LLC, and organized the Warren County Environmental Action Team. Welcome, Bill.
Thank you. Thank you, Nonie. Honored to be here. Hello, everyone. As you see, I wear a lot of different hats in my community. I live in Warren County, North Carolina, which is the northeastern part of the state. Warren County was once one of the wealthiest counties in North Carolina. Now we're labeled as one of the poorest, but I don't think so. I pretty much started my work as a community researcher around healthy food access and physical activity. Working as a health ministry coordinator for my church and association, we focused on proper nutrition and physical activity as a means of preventing or managing chronic disease. And once we did a community assessment, we realized that many of our people who lived in rural North Carolina, in my county, didn't have access to healthy foods. We're losing our supermarkets, and many people were shopping from convenience stores. I thought it was ironic because Warren County historically was a farm community where people grew their own foods and were very resilient. So I wanted to work with my research partners to see what impact we could create by engaging our people and growing our foods again. So now I serve as a staff member at the Center for Health Promotion and Disease Prevention at the University of North Carolina as community outreach manager, which I serve as sort of a liaison between academia and the community that I somewhat aware of. If we could progress to the next slide. So in my slide presentation, I start with projects we're doing in several counties across the state where we're engaging SNAP eligible families in growing their own foods. So we've done community gardens and we're doing raised bed gardens as well to help make healthy food more accessible for SNAP eligible families. These are research projects, and from our research, we try and learn. And as we progress to use what we learned to be better at what we're doing, we found that we need to really engage the communities that we desire to make an impact. So some other projects that we're doing from the university is, of course, we're doing a child nutrition project that's being led by No Kid Hungry North Carolina, which is situated in our office. We have a project called Communities on the Move, where we are helping create safe spaces for physical activity in marginalized communities. We've also do a project called Community Circles, where we actually go into communities and we bring those people, our focus groups of people who are SNAP eligible, around the table to let them define what their issues might be, what their strengths might be, what their challenges, but engaging their voices in our projects even before we design a project. We, in certain counties in North Carolina, we're helping develop local food policy councils where, as we begin to reestablish food systems, that the marginalized voice, population voice is engaged in the conversation and have a part in the conversation to make healthy foods more accessible to them, and also so their voice might be included in whatever policies come out of the discussion. We are also doing projects around healthy retail. As I mentioned before, many of our rural communities are losing their supermarkets. And so we get people now shopping at corner stores or discount stores for their foods. And so we are working with corner stores and other places to promote healthy foods and measuring the impact that might have on accessibility. And we do a lot around the area of social marketing. So the picture you see now is a garden project that we developed within a mobile home park. And we realized there are other issues that our people are confronted with. We grew gardens and produce to present to people, and some couldn't even use them. They didn't know how to cook or didn't have a place to preserve their foods. So we see that our work must be much broader. We must work with other sectors in our community to bring about sustainable change in policies and access to resources. If you could advance to the next slide, please. Here's one of our church garden projects, and we invited in some youth from our summer camp to introduce them to gardening. And hopefully from this introduction, some of our young folk will decide to use the land that we own to become future farmers or food producers. So we are using our projects as mentoring opportunities for our young folk. And next slide, please. Here, as we were growing our gardens, there was a question asked, was the food we're growing in our gardens safe? Because Warren County is known as the birthplace of the environmental justice movement, where we got a toxic landfill dump sited not too far from our church. And so that led me into working on a project which I call Warren County Environmental Action Team, where we began to help tell our story about how we got dumped on and birthed the movement, and how we are pursuing to own this movement and be on the cutting edge of environmental friendly practices. The picture to your right is well, there I am in the picture, but it's AFG Adventures. And there we have some executives from AFG and some of our faith community leaders. And our next goal is building solar powered greenhouses to produce organic fruits and vegetables for the market, but also provide job opportunities and access for residents in Warren County and surrounding areas. So I like to see my mission is to be help my community transition from a victim to a victor, to take a negative story and use it to elevate ourselves, to make healthy foods more accessible, but also to engage our voice in policy. So I'm a researcher, I'm a minister, but mostly all I'm just a social entrepreneur who has a vision for my community and the communities across the state, and work along with researchers and funders to make these visions realities. Thank you for listening to my story.
Okay, thank you. Thank you, Bill.
Thank you.
Thank you, Taylor. Thank you, Suzanne. We're going to do a little bit of directed questions for a few minutes here, and I have a couple of questions to ask our panelists. The first question for each of the panelists to speak to, if they would like, is how did you identify what your community needed? We've heard from many very different communities, so whoever would like to speak first.
Hi, Nonie, this is Taylor. I am actually going to preface my remarks by stating that I actually don't live in the Western Tidewater community in which I work. And I don't necessarily always identify with the community in which I serve. And on many occasions, I get called out for having a little bit of a Midwestern accent to my y'all, because I'm not even from the South. So that being said, it was really important for me to get boots on the ground and embed myself within the community. I've been a part of many different subgroups. You know, I've grown up in a rural community, and as a military spouse, I've seen a lot of people come into different subgroups thinking that they know exactly what is needed as an outsider. But the reality is the answers actually lie within the community itself. So what we actually spent a lot of time doing was site visits. We wanted to sit down and have a conversation with clients, with service providers, with key stakeholders, the local government, anyone that you could imagine. And we significantly underestimated the amount of time this would take, because oftentimes we would sit down with someone and then they'd give us a list of 3 or 4 more people that said, you know what, you need to go and have a conversation with these folks. But that was a wonderful thing, because we were able to start getting community buy-in by having those introductions to different key stakeholders within the community. Of course, I was concerned about having conversations regarding food insecurity during these site visits, but we wanted to see the larger picture. You know, we wanted to know the opportunities and challenges that these organizations were having. And then we also started asking the question of, you know, if you had a magic wand, what would be the one thing that you could change? This was really insightful to us, and it allowed us to do better at asset mapping and also connecting services and starting to create those small wins within the community.
I would say, this is Bill, I would say all of the same, but it also helped me because I am familiar with the community. I grew up in the community or similar communities, but even with that, I couldn't speak for the community as a whole. So we had to do some surveys and engage people in conversations, listen to people's stories. And it was a long-term investment. I've been doing the work that I'm doing for about 15 years, and we're still working to develop better relationship and get a better voice or needs or priorities of the community. So again, I think with the surveys and building relationship and going places and spaces that you don't normally go to really hear the true voice of the community.
This is Suzanne, and we did very thorough needs assessments. Again, ones that absolutely captured community voice. in a variety of populations and places. And so we looked at a variety of areas, from assets to barriers to having people do photo voice and take pictures so they could share through stories. And we did that at the beginning, and then we actually used that. We had kind of almost a booklet for the communities that we developed. It was probably 10 to 15 pages, and we gave them their data back. And that was so important because as they had their own data, they realized how they could use that then to go after other funding and really all the assets that their community had. So again, a variety of methods and tools, and then giving data back.
Okay, thank you. Thank you. Yes, it really shows the diversity among the communities and the ways that one can touch those and find their needs. I need to ask, we have some people who are asking questions on the chat. Please go to the question and answer if you want answers to your questions. The chat is just for us panelists to talk to each other. Thank you. Okay, second question. All right. How did you build your community trust? That's very important, and people don't like to work with you if they don't trust you. Anyone want to start?
This is Suzanne. I can start on that one. So it's, for us, again, we were working primarily in tribal communities in South Dakota, and so had to hire the right staff members to do this. And with the hiring, it needs to, I firmly believe it needs to come from the community, and they need to be trusted members, and often they need to, you know, be members of that community. So we hired primarily tribally enrolled individuals who could speak to that community, who were respected and trusted. And so I think, Taylor, you addressed this early on too. It's not about us coming in top down. It's really asking who can do this work. What are those skills that you necessarily can't train for to build that trust? But who are those individuals that just have those skills and can do that work? So are they representative of the population that they're serving, I think, is what we need to ask as we do hiring.
This is Taylor again. I definitely agree with what was previously stated. Once again, when we started kind of scoping out who our key stakeholders were, where we wanted to have initial conversations, we used that as an opportunity to capitalize on introductions being made instead of us cold calling folks who might be a little resistant, you know, as folks from Norfolk, the city, coming into the rural communities. And that made a huge difference. The other thing that I've really noticed too is just the element of showing up and being present has been really impactful. It's important for, if I'm going to be connecting with these folks, then I need to be out there, boots on the ground, getting my hands dirty as well. And then the other thing that was really, in hindsight, I think that built a lot of community trust was, as we were doing these site visits, we were ultimately looking long-term for different partnerships and, you know, at our strategic plan and where we were looking forward. But there were a lot of things that were very small wins that we could hear a need for and then immediately close that loop. That way we could emphasize that we were co-creating those small wins, which would foster some better collaboration. And then I think it goes without saying, but just having those honest, genuine conversations. And one thing that I've learned in the long run is being an outsider, to not necessarily be afraid to sometimes call out the elephant in the room, because being an outsider can be seen as a negative thing. But on the flip side, there are some things that the community that's so embedded within itself may not realize. So just finding a way to, you know, diplomatically have those conversations that are honest and coming from a place of, you know, genuine interest and wanting to better the community.
We build trust by working with faith communities and trusted organizations. Again, as was said, creating spaces where we can communicate and even develop common language and understanding. But long-term commitments, and putting partners' priorities up front and being fluid about that.
Okay, thank you all for your responses. One thing I noticed is that in our community, looking at trust, as you get out there and you're doing your work, people hear about you, but you always find the people coming first that have a heart for what you're doing. And I think each of you also have that heart. And when you're talking to people who are strangers, whether you come from the community or not, your empathy always shows through and your honesty. I'm going to now turn it over to Tracy Fox for some question and answers from our attendees. Tracy.
Sure, thanks Nonie, and thanks Taylor, Suzanne, and Bill. I'm just struck by how different your communities are, and that also leads to very different approaches, but certainly some similar themes as well. We've gotten a number of good questions, but all of you out there listening, please continue to put your questions in the Q&A box, and we'll try to get to them. And if we don't get to them now, we'll certainly try to follow up with our speakers as well. So thanks for the ones who have been submitting some so far. Overall, this is a question I think geared to all of you, so feel free to jump in and answer. What are some of the partners that you do have joining you at the table, since you all have such unique communities that you're working in? And then I think sort of on top of that, and what I always find interesting is, who has surprised you the most? Were there people or organizations that you really didn't even think about, didn't even think to connect with, but they ended up actually being some of your strongest champions and spokespeople? So who are the partners, two questions, two-part, who are the partners you're working with? And then most importantly, what are some of those surprises, and how can we make sure that we're tapping into those advocates that we might not ever have thought about to begin with? So Bill, I'm gonna just go ahead and ask you to start with that, and then we'll just follow along with Suzanne and Taylor.
Wow. I thought I have a little time to think. There have so many partners, but I think an important piece that I felt really important to my community is to help my community to see our resiliency, because we've been labeled one of the poorest counties, and many other people I know have taken on that label. And so when an opportunity would present itself, they would say, wow, they won't let us, or it'll never change. And I was hoping our research would help people that we all have a voice and we can bring about a change. So that's why our legacy as the birthplace of environmental justice was so important to me, that helped our community understand what we did. We birthed a movement. We got dumped on and we birthed a movement. And so most recent partner that I've been working with for the research is from the University of North Carolina. It's a study of the American South, and we're doing oral history documentation, where we're going and we listening and letting people tell their stories about growing up in rural North Carolina, how resilient, how self-sufficient, how we were a part of a bigger community and had networks of supports. And so helping our community see its own efficacy, its own power, its own voice, and so that our research and our partnerships can be aligned with assets, in which is human capital, skill, and knowledge. So within the university, I'm finding so many awesome resources in partnership, University of North Carolina. And that's not to include all those in the community, but that's what comes to the top right now. Because I feel if we're gonna make sustainable change, we need to help empower our focus groups, or our focus people in the process. Those are my thoughts. Thank you.
Great, yeah, I love the oral history part of it as well. That in such an engaging way for folks to really share important things about the community. Suzanne, any thoughts on kind of who is at the table for you and surprises?
Yeah, so it looks so different in working with, rural communities versus urban communities. But I think some of the ones that ended up surprising us were that having like police, sometimes you don't think about officers, and working on health and physical activity. So along with navigating health in general, we were also navigating some race relations that were going on in the community. So there were some beautiful stories that emerged from that. Another piece I think we often forget about, and it took us a while to really grab hold of, and Bill showed these beautiful pictures, but youth. And so I think we had to work extremely hard to make sure that youth voice was always at the table and was in our decision-making process, because those are our future leaders. And so I think sometimes it can be easy to say they're busy or we don't think about our meeting times. But how do we champion getting youth to the table and creating our next level of spokes individuals?
That's always a challenge. Taylor, your thoughts, and actually I think, Taylor, one of the other questions we got, which fits nicely with this overarching question, is in terms of your work with the Hispanic community you mentioned that are residing primarily in the Eastern Shore. How has your response to COVID-19 really incorporated their community needs and perspectives? And then certainly feel free to also chime in on who have been some of your biggest surprises in terms of champions.
Sure. So I think that, I had previously only worked within the suburban and more of an urban community, although I had grown up in a rural community, so I did have that connection. But I was very surprised. I went into the rural communities with kind of a misconception about the task force and groups and organizations that had already been formed. I didn't anticipate that having happened. So all of our work really started out in Western Tidewater in terms of building capacity because of a large multi-year grant opportunity through the OPC Healthcare Foundation. And as part of that, I thought, we're going to get like a key stakeholder group together that meets bi-monthly. And we did, and we still do, discuss primarily food insecurity issues. However, I discovered that there was a health and wellness coalition that had been established for many years. It has a huge turnout each month, and I realized that was the place that I needed to go to start making my connections with folks. So that was definitely a surprise. Beyond that, we are working with our traditional local governments, the faith-based community, other service providers, school districts, healthcare providers. And in regards to the question that was asked about our Hispanic community on the Eastern Shore, I think that's where all of these collaboration and having asset mapping comes into play. So specifically on the Eastern Shore, we have a partnership with the Rural Health Network through a program that we call our Healthy Food Pantry program. And so they have been instrumental in connecting clients, especially our Hispanic clients, to the resources that they need during this time. So for us, it's a lot of recognizing that we can't do everything by ourselves, but we have a lot of great organizations that we partner with that we can move our mission forward.
That's a really good point, finding others who have the trust within certain communities to really, I don't want to say carry the water, so to speak, but to really be the spokespeople for some of your initiatives. The next question I'm going to ask is specific to Dr. Kearney, because you had mentioned the community circles, and I think that's a really interesting and important aspect of some of the work you do. So can you just tell us a little bit more about those community circles and how you start them, how do you facilitate them, those types of things?
Okay, that was a learning curve for us because many of the projects were developed and initiated at the university level and taken to the community. And we began to get pushback from some of our community partners because they felt like we were perpetuating systemic racism, and they had so much to want to share and didn't necessarily want us to be defining what their priorities should be. So we sort of backed away and began to do a little more research in the area of community circles. And our team leader for that, who's Tiki Windley, in essence, brings together, our focus is SNAP eligible members of the community. So bring together a group of SNAP eligible members and pose questions and open-end questions, let them define maybe what is poverty? What does poverty mean to you? What are the assets in the community? What are the challenges? If you had your magic wand and you could make this community what you want to be, what would that look like? But pretty much, even before we began to pose our questions, engage the community in conversation to hear what their priorities are, what their assets are, what their challenges are, and what resources they need, and how we as the university represents funders can use our resources to help them be more engaged in defining what their questions, what their needs might be, and be engaged in defining what the solution will be, long-term investment. So it's just allowing community people to take the lead in the conversations.
That's great. And that sort of leads to another question I kind of want to ask all of you in terms of, you've talked about how you've been able to build community trust, et cetera. And I think, Taylor, you touched on this a little bit, but what didn't work? What did you kind of, and actually even Bill, you just mentioned, you kind of were bringing something to the community. They're like, not so much. Let's co-create this together. What are some other things that if any of our participants are listening out there would be like, oh, I'm going to do this. What would you advise in terms of don't do this or don't do certain things because it just doesn't work out? And if it's an experience you had and you're comfortable talking about it, please do. But I think sometimes it's as important to know what doesn't work as what does work. So I'll just open that up to anybody who wants to weigh in and share your cringe stories with us.
This is Taylor. So one of the things that I will say I'm struggling with this currently is initially when I started going out to build relationships in the community, I was there constantly, nights, weekends, etc. And as we're starting to scale up, I realized that I can have a presence, but I can't be there 24/7. This area is about a little over an hour from where I live, where our main office is at, and we all have competing priorities. So figuring out a way now to still have that presence while knowing that I can't be present and getting my hands dirty with every task and distribution and initiative that we have going at all times.
Helpful. I think not unusual for us all to think we need to be at every place at, all the time. Suzanne or Bill, want to share any of your sort of would never do that again or advise others not to?
I don't know if it's about never doing again, but I think the word and the term is flexibility. And so like with our pantry project, we had a toolkit in mind. We had somewhat of a plan that we thought communities could follow. And so, and then they surprised us and they said, no, we don't have the space for that. Or can you imagine this in a different way? Or, they're just very upfront and we appreciate that. That's not going to work for us. So I think just in the moment being able to say, okay, then what will work for you and how can you help us to build that? So each community knows their strengths and has their assets. And I think if we're flexible and just admit that we don't have all the answers, I think that really helps in the end.
That's a really good point. Don't come in with preconceived ideas that have to be a certain way. Bill, you want to just kind of briefly provide any?
I would think to be aware that not everybody experience the same spaces as you do, and that people's stories are important, and oftentimes it's not what they say, but what they don't say. I say that relative to racial injustice. And so many times we wanted our people to do great things, but we didn't take the time to value the history and the stories of marginalization and oppression. And now we realize that our work should help people elevate their voices to address these things. We have to do an immediate intervention, but we have to help them gain their voice and vocabulary to begin to address racial and environmental and other social injustices. So
really
be very attuned that not everybody experience reality as you do, and listen to people and help them have a voice to express themselves.
Well, that is a great way to sort of end this part of this session. And I want to thank Nonie, Taylor, Suzanne, and Bill for your participation, your remarks, and your commitment, especially during these really tough times that you were able to participate today. So with that, I'm going to turn it over to Derek Lambert for some closing remarks for this virtual Rural Child Hunger Summit. So Derek, over to you.
Thank you so much, Tracy, and thank you so much to all of these panelists, those from this session as well as the entire day. I want to thank everyone who was involved in organizing this event. I want to thank everyone who spoke and shared their knowledge and expertise, and I want to thank everybody who attended as well and took the time. We know there is really so much experience, there's so much learning, there's so many stories, not just among those who had the chance to speak today, but those who also took part in this event in any manner, whether it's by phone, listening or participating on their computer, typing in on the chat and the Q&A. So I just want to thank everybody who was a part of today's event. I also want to say a special thank you to the sponsors of today's Rural Child Hunger Summit, who, as Courtney said earlier in the day, have been so supportive of this work and our change to a virtual platform as a result of the coronavirus outbreak. A big thanks to the Arby's Foundation, CNS Wholesale Grocers, and the Walmart Foundation. And we didn't mention this earlier, but I'd also like to take a moment to thank our Rural Child Hunger Summit Steering Committee members. I'd actually like to name them, take this time to read out the names of the folks that were involved from really all across the country. We have Dr. Robert Taylor, Superintendent from Bladen County Schools in North Carolina, Dr. Deborah Moore, Board President of Delta Fresh Foods Initiative in Mississippi, as well as Judy Ballou, Executive Director of Delta Fresh, Megan Lovelace, Senior Consultant of Mountain Harvest Consulting in Colorado, Shannon Amos, Vice President of Agency Programs with Children's Hunger Alliance in Ohio, and Sonia Hill Powell, Senior Manager of School and Summer Nutrition with Children's Hunger Alliance, Donna S. Martin, Director in School Nutrition Program at Burke County Board of Education in Georgia, and Maya Price, Manager of Federal Nutrition Programs at Feeding America. These are folks who really did so much to inform and to guide the development of the content that our panelists and speakers and many staff at Share Our Strength have really developed and continue to build and to craft in the last several months. I want to just remind everyone there will be follow-up materials for all who registered. You'll receive recordings of today's sessions and slide decks. You'll also receive a survey. We'd love to get your feedback on how we can improve future convenings of the Rural Child Hunger Summit as well as other virtual events. And I would encourage you to visit our website, bestpractices.nokidhungry.org, for additional resources around the COVID-19, the public health crisis, and the resources that were mentioned throughout today's event, as well as follow-up materials from today's virtual Rural Child Hunger Summit. You can click on the events tab in the top right and access those resources by clicking along through the Rural Summit. Additionally, as Courtney mentioned in the opening remarks, that we developed a lot of content. We worked with a lot of folks as it pertains to faith community engagement, schools, and other content that we'll be sharing in the weeks and the months ahead. So stay on the lookout from that. Again, the best way to stay in tune with that, to stay connected to us, is to subscribe for our newsletter, which you can do at bestpractices.nokidhungry.org. I just want to thank you again for joining us today. A very special thank you to our panelists and to those who made today's event possible. I also want to thank my colleagues at Share Our Strength with our No Kid Hungry Center for Best Practices for all the work that they put into this and for their good spirit and goodwill as we transition from a physical convening to a virtual summit. So without further ado, thank you for taking time today, and we'll be in touch. Bye-bye.